Hi, I'm your host, Marsha Florence with Just Ask Podcast Live. Thank you, ladies and gentlemen, for tuning in on this cold day. Now, I don't know where you are, but it's warm in here. So, while it's warm in here, I wanted to be able to share with you some good information. Now, ladies and gentlemen, as usual, when we seek out individuals to give us some resources, it's something that you can use, you and I can use, okay? So don't ever think that it's just a one-way street. All right, so I wanted to introduce to you today a returning guest, and this gentleman is my first time doing a podcast with him, but he always comes to the studio every year like clockwork. But this time we wanted to get a little more in depth about some insurance information. And let me say this: a lot of you have insurances and don't know what the benefits are. So today, Mr. Rodney Ross of Ross Insurance is going to give us some insight on what it is that you're using or can use with your insurances. Okay, so if you got questions, here is the number as usual: 1-800-323-5336, and you can always call me and say, hey, Marsha, I need to talk to Rodney Ross because I'm not sure about my coverage. Something's missing. All right. And or any other questions that you may have. So without further ado, let's go to our guest, Rodney Ross. Good afternoon, Rodney Ross.
Hey Marsha, how are you doing today?
I'm good, good, good to see you.
Happy New Year to you.
Same to you, as they say, good to be seen and all that good stuff. So, okay.
All that good stuff.
So Ronnie, like I told the viewers, normally you come to the studio mainly in the fall, and you guys come and see us and tell us about some services that people are not familiar with, or what's going on in the insurance game. All right, but
Well,
this particular time, I need for you to fill in some gaps for us because a lot of people have policies that they're not sure about what the benefits are and how to utilize it. So I just want to see if you can fill in the gap today and answer some of those, uh, you know, awkward questions that people have, so that they can either want to call you or call me, or they say, "Hey, I'm satisfied right where we are."
I'd be happy to do so. I don't know that we have enough time because I got about 9 hours of answers.
Okay, okay,
But
okay,
let's go ahead and do
okay.
it.
Well, we'll give it a shot. So it's the beginning of the year. People have these brand new policies. What are some of the benefits that they should look for in utilizing these new policies that they have?
So a couple things. As we start a new year, first of all, people come into the new year and they have all these resolutions or changes or things they want to do in the new year. A healthcare plan can play into supporting some of those things. For example, people often say, next year I'm going to eat healthier, I'm going to live healthier. Well, you know what? There are health plans that have benefits that will actually support those endeavors. Many health plans, Medicare plans for sure, but a number of employer plans, they have benefits where a person is able to see a professional person called a dietitian. Now, many people, they hear the word dietitian and they think about people that are sick. They go see those people called dietitians. Well, halfway right. The other half of that is a person as a dietitian, they're able to help us talk about and understand how food that we eat, how it impacts our body, and the differences in food, and how to help us have a healthier lifestyle when it comes to eating. Health insurers, as well as employers, have come to understand that preventive benefits and prevention helps to keep the costs down of health insurance. Anytime you can find issues going on with the person before it becomes a chronic condition, it's less expensive to treat. So many plans, they have benefits where a person can see a dietitian. You go see a dietitian and they'll interview you, ask you a bunch of questions, and they'll help you figure out what foods work best for your body and your particular individual goals. And the
Okay,
good
now
news,
Rodney, I got it. I got to say something about that, and I didn't mean to cut you off. So,
Go
on
ahead.
the average, most people wouldn't even know that they have the option to go see a dietitian. And better yet, are there some dietitians or services that they can have the person come to their home? So, you know you're not eating healthy. Okay. So, you go to the doctor. Is it the doctor's job to set up the dietitian for the patient, or can the patient or client call the insurance company and say, "Do I have dietitian coverage so that I can get someone to see me, whether it's a home visit or if it's an office visit?"
It can actually go either way. If a person
Great.
has a primary care doctor and their doctor is having a good proactive conversation with them about, hey, listen, you could probably benefit from, I noticed that some of your levels were high. If you made some lifestyle changes, perhaps with no eating to start there, you perhaps, can change, some of your outcomes. So the doctor can absolutely start that conversation, but a person can do it on their own if they call their health insurance company and say, hey, you know what? I would like to know, just do something different next year and I need some help. What kind of benefits, are available to me that I can utilize? So we can go both ways.
Okay. Okay. Because, we're talking about baby boomers and beyond, or before, prior. And so a lot of people, they get these insurances and they're so excited that they can get free groceries, transportation, gift cards. The excitement of that tells me there's got to be something else besides gift cards, free groceries, and transportation. Now, the transportation I'm all for. I'm all for all three things. But my concern is that the average person may not know how to formulate the question to find out from the agent, what else can I get with this? Or what else, how do I know that I can get uh, my dental, my vision, my hearing? And now that you said something about nutritionists, or a dietitian, I think dietitian should be at the top of the list on that form when you say this is the things that you are eligible to receive.
So see, Marcia, what you just hit on really is the crux of one of the downsides of our health insurance industry. Persons not having a good, trustworthy agent that they work with, a person that they have casual conversations with, a person that fully, completely, thoroughly explains to them not just what the benefits are, but how to access the benefits. And that's not that's the very front side of a person utilizing benefits. For example, one of the most underutilized benefits is the fitness program benefit. And I intentionally called it a fitness program versus gym membership because people think about gym membership and, oh, I need to go in and lose some weight, blah, 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 blah. But fitness programs that the health insurance carriers offer, those programs don't just have you can go to a gym. They also have benefits and features for the person that either cannot go to a gym or doesn't want to go to a gym. For
Hmm.
example, you can access online benefits by no recorded benefits and features. You also, there's some carriers that they will send technology like Fitbits to a person. So there are just many options and the gym membership, people think about gym membership, but come on now, that's like the New Year's resolution. I'm going to start going to the
Oh
gym.
yeah.
Yeah, right. As part of
Oh
a
yeah.
healthcare plan, many plans have a fitness program, and people just really don't understand the breadth of the benefit options in terms of how to use it. One more point about the fitness program in terms of it being underutilized, another part of that underutilization is people not using the water therapy. Going to a pool for persons that um, perhaps they have mobility issues, if you go into a pool, buoyancy, the water, it lifts you up and you're able to exercise and not put your limbs, your bones and your joints at risk while you're getting exercise in the pool. And that is part of the fitness program benefit with many carriers.
But you know what, Ronnie? A lot of people, I find that they're hesitant. Some say, well, a lot of people are up in age and they're not sure if they want to be seen and go out and do things. But when they go to the doctor, a lot of people are shying away from going to the doctor because they think it's too expensive between the copay and the deductible at the beginning of the year.
So it is not cheap. Let's start right there. The healthcare system in the US is not one that just is zero cost where the insurance companies pay everything. That's not the way this system is set up. However, with that being said, if you have a Medicare plan, Medicare, the government requires every Medicare company to provide 24, 24 preventive care benefits at zero cost. 24. That is diabetes, that's your heart, that's your liver screening, your kidney screening, mammogram, um, vaccines. All of those are part of the preventive care benefit at a zero cost. Now, here's the flip side. Preventive services and benefits are great because it helps potentially identify issues early that, when addressed early, are less expensive than when it goes full blown into a chronic condition. But
Right.
understand, the screening itself is a zero cost. Here's what happens though. When there is a diagnosis that, oh, wow, we think we see something. So now we need to do diagnostic testing, diagnostic procedures. That is where the cha-ching starts to happen
Mm-hmm.
and the co-pays
Mm-hmm.
come in.
Okay. Okay. Ronnie, I wanted to ask you, what is a hospital indemnity plan?
Hospital indemnity plan. So a hospital indemnity plan, in plain English, it is a plan that a person buys and it covers a certain set of health treatments. If a person has a health treatment that has an out-of-pocket cost, that hospital indemnity plan will directly pay that member the cost. As an example, Medicare Advantage plans, they all have hospitalization. So you can have a inpatient hospital admission, but there's a copay for those admissions. There's a daily copay. Some plans, let's just say that it's $200 for the first 5 days. If you're there for one day, $200. 5 days, it's no 500, no 200 times five, $1,000. Now, if you have a hospital indemnity plan that covers your 5 day stay, at $200, they are going to send a check in your name to your home for you to use to pay that expense. That's a hospital indemnity plan. They actually cover quite a few features and benefits, but just the bare bones. The most effective benefit is the inpatient admission because that's also one of the most expensive copays that a person can experience in their healthcare plan. And they're
Now,
inexpensive.
you know I'm going to ask this famous question. So, how many people, off the record, would know to apply for a hospital indemnity plan, and when is it mentioned? I mean, we're talking about it, but how many people are really aware of such a plan, and how do they make payments, to acquire that plan?
So here we go again. It always goes back to having a person, a agent, a broker that is efficient and effective and cares about the person. Because when you say, so Rodney, how's a person find out? So with our team and our organization, when we work with clients, first of all, we take care of their health plan, first of all. Once we have their health plan worked out, we then have the circle back conversation about, so listen, part of your health plan is this inpatient admission. You have inpatient coverage, but it's going to cost you $200 a day for the first 5 days. Would you like to understand or know about how you can buy a plan that will cover those 5 days at $200 for you at a relatively low expense? I don't have anyone tell me no. The answer is sure. And we then explain what a hospital indemnity plan is, how it works, and we start by just telling people about the bare bone feature of the inpatient hospital. Now, we let them know there are quite a few other features and benefits, but that's going to hike up the monthly premium. The average monthly premium is about 29 to $33 for most people.
Okay. Okay, but Rodney, so let me say this. So on that note, do you is the hospital indemnity plan renewed every year?
No, it's like your auto insurance. You purchase it. Well, I guess it's not like your auto insurance. It does not
Mm?
renew each. You purchase it once and you just continue paying the premium. And there are a bunch of companies that offer them. And this is why it's really important for a person to do their homework and to talk to someone that they trust because not all hospital indemnity plans are created equally in terms of what they cover, the claims process, and the premium. There are many companies sell them, but quite a few companies, they can be pricey.
Mm-hmm. Mm-hmm. Because most of I mean, when you get insurance, you think you're covered, but some of the expenses of some of the, the medical treatments or dental, whatever, the out of pocket. I think a lot of people get turned off because they say, "Well, I don't have that kind of money for that's an extra cost. I'm already paying the insurance." I had a gentleman tell me, he says, "I'd rather pay out of my pocket to go see the doctor because I don't get sick that often." And I said, but you can't determine when you're going to get sick. So he didn't want to have the money removed from his Social Security check because he says, oh, I can just pay out my pocket. And I was trying to explain to him, well, what about the tests and things? You can't pay for that out your pocket because that's what's going to eat you alive. So he was under the impression that just going to the doctor and paying the office visit was, substantial for what he needed. But I'm looking at him like, do you not know if the doctor said when you need to go to the hospital that that's when the real bill starts and you can't pay that? Or did you know that once you give blood and he has to run a series of tests that you can't pay that? So just so happened he got sick and went in the hospital and he went to our famous hospital, Detroit Receiving, which he did get treatment, but now we talking about ongoing situations and now we're talking about, you getting your primary physician and everything. How is it that people try to downplay their health over a few dollars? And I do say a few dollars because I know we paying car notes, we paying insurances, we paying utility bills. But when it comes to your health, ladies and gentlemen, you can't beat that. I might not have, I might miss a bill or two every blue moon, but it won't be my insurances. My mother always said, you could be in the house in the dark, but you better pay those insurances. So that's just me. But why is it, or how is it that people downplay so much the health care coverage? Is it because they don't think they're going to get sick anytime soon?
So, Marcia, that's a complex question because that question really, gets into human nature. And do I run across those kind of conversations? I absolutely do. Um, and I tend to be, really patient when I'm talking to someone that, kind of has that world view. And I don't make an effort in a single conversation to change their mind. I try to just keep the conversation open with them. So they're receptive to me. I'll check back in with them. Let's say in a month or so, hey Bob, I'm just kind of following up on the conversation we had, about healthcare, and see, if you have any kind of different thoughts or you want to talk a little bit more. Now, here's what I have found. I have found that when I have been able to get a person comfortable talking with me, comfortable that I actually have some information that might be helpful, and comfortable with the idea that maybe there's a better option than what their initial game plan was. I have had, some instances in which people have changed their direction and they've, done it about face. But, it's really human nature, and there's no
Okay.
magic pill, unfortunately.
No, there isn't.
And
But
the downside
I'm looking
is
at
I
it.
can't.
I'm looking at one of these questions here. Are there any ways for a person to reduce the expenses while at the same time using the benefits?
Well, so there are three options. You mentioned one of them, that's a hospital indemnity plan. The other two options, and one is not so much an option. Um, Finances play a whole lot into people and their access to healthcare. People that are living at the federal poverty level, which is defined as one's ability to buy groceries and food and housing, when persons at that poverty level, they qualify many times for Medicaid programs. If you qualify for a Medicaid program, you can end up in a Medicare plan that has a cost share provision where your cost is zero. And those are the plans that people hear about on television and the radio about get free groceries. You can pay your utility bill. You can do this, that, and the other. Those are plans designed for people both Medicare and Medicaid. Now, the downside is not many people intentionally want to have an income at the federal poverty level and need to have Medicaid support and assistance. It just happens to be their situation. Now, if that's your situation, this is a safety net, and you are able to obtain good healthcare benefits at no cost. The second
Mm-hmm.
category
Mm-hmm.
is the persons whose income is 500,000 and higher. Now, those persons, they either write a check for their medical coverage or they get a Medicare supplemental policy, which is an insurance policy to pay their co-pays and their co-share, no cost share for them. They can afford that, so no harm, no foul, they can afford it. It's really all of the rest of us that are left that don't qualify for the Medicaid. We're not in the $500,000 no rare air, so we have to find less expensive ways. A couple things. People need to understand all Medicare and health plans are not created equally. And you really need to do your research. If you can't do the research, find someone that you can trust that is knowledgeable, has answers, and can assist you in driving and being guided to those plans that offer the most benefits that you are in need of at the lower cost. They do exist.
Okay. Okay. Because, Ronnie, I'm going to say this. Now, we know that every October through December is open enrollment, and the phones are just ringing, 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 ringing. And people are just flooded with all kinds of calls from
Yep.
all directions of insurance agents. And then January to March, what is that called? I forgot what it's called. What's the changeover where you can't call us, but we can call you?
That's the that's the Medicare Advantage open enrollment period.
Oh,
MA
okay.
open. That's where
Okay,
we
so the
are right
open
now.
enrollment period, that means that I can call and change something if I disagree with what I already had.
As long as so it means if you have a Medicare Advantage plan, yes,
Hmm.
you are able to make a change, a one-time change between January 1st and March 31st in that plan. One-time change,
Okay.
yes.
Okay.
Now,
All
the
right.
key to it, a Medicare Advantage plan, which excludes persons who are on original Medicare and they change their mind and decide in January, I don't want to be an original Medicare. I want a Medicare Advantage plan. Now, the door is shut for them.
Okay. 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 All right. Well, it's so much in the insurance, I'll say, game that we have to address that I think a lot of people just get turned off because, like I said, when you get flooded with calls from October to December, and then all of a sudden in January, you say, "Oh, I got this coverage and I don't like it." Now I got to call and find me another type of benefit service. Oh, well, now these people offer me transportation, and a lot of people like that component, transportation, and I agree with that. But they may be missing something else. I want to make sure you got hearing, vision, dental, tests. I want to make sure you have everything, ladies and gentlemen. I don't believe in just because somebody's going to send me a food basket or a gift card every 2 months that's going to suffice. I believe that I want to know that if I get sick or if I need my hearing aids, what percentage will the insurance company cover for the cost of a new set of hearing aids so that I don't have to spend a lot of money out of my pocket or meet me halfway. I want to know my dentures, okay, my bridge, whatever else is covered through my Delta Dental or whatever else that I should be able to use. So, Rodney, I know we're running out of time, but, is there any comfort zone for people to understand that when they're using their insurance, use it to the best and to the fullest?
The best advice, Marcia, when I'm in studio or right now, the best advice I can offer anyone, especially Medicare beneficiaries, is stop talking to 800 numbers. Find you a living Medicare broker that does not work for an insurance company, but it's an independent broker that writes business for multiple companies that can answer your questions and guide you to options that you can just make a good, better, sound decision. And you'll find that an independent broker, they meet with you and they actually bring the material to you and sit in front of you and read the material. So you're not guessing about what you're getting. It's covered with you live and in person versus over the telephone. You have nothing in front of
Okay.
you and someone just flapping their lips. And then you can't reach that person
Okay. Okay. Well, Rodney, I'm running out of time, but will you come back and see us again?
whenever possible. Absolutely. My pleasure.
Okay, when I want to post some information about you up on the screen. Oh, there's that handsome gentleman, ladies and gentlemen. So if you need some information, and you know you do, you can actually reach out to Rodney Ross, okay, from Ross Insurance Group, and you can always give us a call, 1-800-323-5336, or his number is on the screen as well, 313-655-3260. So with that being said, hold on for me 1 second, Rodney.
I try to keep up with what these young people is doing and knowing.
I was at work and I just got a text from a number that I didn't know.
I sent him a text. He texts me back and say, "Who dis?" And I just thought that was the funniest thing.
The next few weeks, she just made fun of me, like would answer the door and say, "Who dis?"
Who dis?
Drop off a warm meal and get more than you expect. Volunteer at americaletsdolunch.org.
America, let's do lunch.
All right.
I'm your host, Marsha Florence, for Just Ask. Now, in the new year, ladies and gentlemen, we got new things coming up for you. So we definitely want you to be able to get that information about what Rodney Ross's agency does. So I got it posted right there on the end. Or you can give me a call, 1-800-323-5336, and ask me a question or have me send a question to an individual that you need to get some information from. So keep in mind, we're on PBS Channel 56, several cable stations, YouTube, Facebook, our website, and Instagram. I'm your host, Marsha Florence, for Just Ask. And what do I always say? If you have a question about a person with a disability or just a general question, don't be afraid to ask. Just ask. I'm your host. See you next time.